So we often hear about being gluten-free, and most people don't really know what gluten is, but people who have celiac disease can't actually process what we call gluten, which is a protein in wheat, rye, and barley. It is an autoimmune disease. Some people don't show signs and symptoms, and there's only two ways that people can get diagnosed, either through a blood test or through an endoscopy, where they go into the small intestine and take a look at what we call these hair-like projections called villi. It's how our nutrients get absorbed into the body. So when someone is diagnosed with celiac disease, we often see a lot of nutritional deficiencies, because if those villi are being affected, they kind of flatten and nutrients cannot get absorbed into the bloodstream. Some people do have digestive upset, like constipation, diarrhea, even extreme stomach pain. In the long run, if someone is undiagnosed with celiac disease, there can be a lot of nutritional deficiencies, such as risk of osteopenia, osteoporosis, so breaking down of those bones, and other issues. Different products that you can eat while being gluten-free include rice, quinoa, gluten-free pastas. The grocery stores have many gluten-free sections. Most products that are gluten-free will say gluten-free on the front of the product. However, looking at the back, we just want to make sure those products don't say wheat, rye, or barley, and especially soy sauces. You can have tamari soy sauce, which is a soy sauce prepared without gluten. Take a look at any medications prescribed to you, checking with a pharmacist or your doctor at the ingredients listed in the medication, because sometimes they're not always listed on the bottle, to make sure they're not gluten containing or have cross-contamination with products that are made in a facility that have gluten containing products. And then also double checking a multivitamin, supplements. We want to make sure that those don't have any gluten in them. And then any makeup products might contain some gluten containing ingredients as well, such as shampoos, facial moisturizers, if someone is really sensitive to gluten. Our skin does absorb products. It is an organ, so we just want to make sure that we're all clear on that front as well. If you are directly related to someone who has celiac disease, it's best to get tested, especially those who carry autoimmune diseases in the family. You are at higher risk for developing celiac disease or carrying that gene.